We shall continue with the pharmacological actions of ethanol. The next pharmacological action is on the gastrointestinal tract. Now over here the action totally depends upon the type of beverage which is consumed. That is the action produced on the gastric secretions. That is secretions of the stomach. It depends upon the type of beverage which is consumed. So also it increases the secretion. Okay, basically it produces the increase in the secretion, both directly stimulating the secretion as well as by reflexly, that is by irritating the gastric mucosa. Now again the effect on gastric secretion, whether it is stimulated or whether it is inhibited, that will depend upon the amount of alcohol which is consumed. At low concentrations, it is seen that there is stimulation of the gastric secretion, whereas in case of higher concentrations of alcohol, it results in inhibition of the gastric secretion. Apart from this, it is also inducing vomiting. Vomiting sensation is produced. Also, mucosal congestion is produced and gastritis, that is, inflammation of the stomach may also take place. Apart from that, it is also having effect on the LES, that is lower esophageal sphincter. This sphincter is present in between the esophagus and the stomach. That is, it guards the movement of the food content which is passing from the esophagus into the stomach. Okay, so LES sphincter, its tone is reduced when something has to move from esophagus to the stomach. So once the content is inside the stomach, the tone of LES increases so that it prevents the backflow of the content of the stomach. So the content of the stomach should not go back into the esophagus, because it can be dangerous at times, as you are aware that in case of stomach, acid is secreted. So the content of the stomach is acidic in nature. So if the content of stomach regurgitates into the esophagus, it can be dangerous, because whatever protective layers are found in the stomach region, like say for example it is the lining is covered by the mucus, which prevents the direct contact of the acid which is secreted in the stomach with the mucosa of the stomach. But such protective layers are not found in the esophagus. So in case if the content of the stomach goes back into the esophagus, the acidic content will come into contact with the mucosa of the esophagus, and it may damage the mucosa. At times perforations may also be produced. Okay, so alcohol consumption reduces the LES tone, because of which the contents of the stomach may go back into the esophagus, that is gastric reflux may take place. Apart from this, heavy drinking may also result in acute pancreatitis, that is inflammation of the pancreas. Next, coming to the actions on the liver. Now, generally what people consider is that consumption of alcohol may result ultimately in the liver damage. But it is not like that. The consumption of alcohol always may not lead to the cirrhosis of liver, which is quite common nowadays. But alcohol is not the only reason for cirrhosis of the liver. There are certain reasons why alcohol results in the liver cirrhosis. All the time the alcohol consumption may not result into liver cirrhosis. Okay, now let's see what exactly is happening with the liver in case if the consumption of alcohol is increased. Now small to moderate amounts generally does not produce any damage to the liver. But in case if the person does not maintain the nutrition, in case of malnutrition, however, it can start damaging the liver. So one should take care that the amount of alcohol which is consumed is not too much, and plus the person should also maintain the proper nutrition. Okay, now let's see what are the effects of alcohol on the liver. What changes it is producing on the liver. Firstly, it is mobilizing the peripheral fat, and also it is increasing the fat synthesis within the liver. So fat, because the fat synthesis is increased, the fats may also start accumulating in the liver. Next action is on the proteins present in the liver. So the amount of proteins within the alcohol may also be increased. That is, it may start accumulating in the liver. This is happening because their secretion is decreased. That is, secretion of the proteins from the liver is decreased. That's how the protein accumulation will start in the liver. Then, chronic alcoholism, that is consumption of alcohols over a period of time, may increase the oxidative stress in the liver. So oxidation or liquid peroxidation in the liver may increase. Because of this, it may result in the cellular necrosis. That is, the hepatocytes or the cells of the liver may start getting damaged. They may die. Okay, so necrosis may be seen, followed by the fibrosis. That is, the damaged tissue will be replaced by a scar. Fibrosis is a scar formation. So ultimately, because of chronic alcoholism, oxidative stress on the liver is increased. That is, oxidative processes in the liver may increase, which may result into the cellular necrosis, that is cellular damage, which will ultimately result in the scar formation. That is, a normal functional tissue will be replaced by a scar. One more problem is produced by the acetaldehyde. Okay. Now acetaldehyde, this is an intermediate which is formed during the metabolism of the alcohol. So this is a product of first reaction under the metabolism of alcohol, which mainly takes place in the liver. Now this acetaldehyde, if it accumulates in the liver, it can again damage the hepatocyte and result in inflammatory processes. Okay, so it will result in inflammation of the liver if there is excessive amount of acetaldehyde accumulating in the liver. Apart from this, lipid peroxidation is also increased and the glutathione is also depleted. Now glutathione, as you are aware of, that it is one of the substance or endogenous substance which is found in the body required for the phase 2 metabolic processes. That is, phase 2 reactions of the metabolism of drug or the endogenous substances. So glutathione conjugation is depleted because of depletion in the amount of glutathione. Now, why it is important? Though it is a minor pathway in phase 2 reaction, still it is an important one because glutathione conjugation mainly results in the detoxification of the highly reactive molecules like epoxides. Okay, so these are highly reactive ones or radicals which may result in the damage if they start accumulating within the body. So now, because the glutathione is depleted, the further metabolism of the epoxides or the intermediates or highly reactive intermediates which are formed by metabolism of certain drugs, so it may be prevented. Say for example, glutathione conjugation is very important for the detoxification of the intermediate which is formed by paracetamol metabolism in the liver. So it will start accumulating these epoxide or highly reactive molecules in the liver, which in turn will start damaging the cells of the liver. Now, taken together, all these metabolic changes combined with the nutritional deficiencies, this is actually responsible for the development of alcoholic cirrhosis. That is, oxidative stress, metabolic processes will be increased. Okay, so accumulation of certain intermediates may take place, glutathione depletion. So all these conditions will start damaging the cells of the liver, and altogether if the person fails to maintain the nutrition, if malnutrition takes place, then the condition will be worsened and it may ultimately result in the cirrhosis. And slowly this particular condition, that is cirrhosis, may also progress into liver cancer. Okay, and ultimately the person may even die. Apart from this, The regular intake of alcohol, this may also induce the microsomal enzymes. Microsomal enzymes of the liver are those enzymes which are involved in the metabolism of most of the drugs as well as the endogenous substances. So because of the induction of these microsomal enzymes, the metabolism of several drugs may be affected. It will be induced, okay, or increased or enhanced. So because of which the efficacy of certain drugs may be going down. Because they are metabolized at a faster rate, they may not show sufficient amount of action. So their efficacy will get reduced. Then next, coming to the action on the skeletal muscles. Now fatigue in the skeletal muscles, fatigue meaning general tiredness. Okay, so fatigue is allied, that is abolished in the smaller doses. So the muscular performance will be improved under the influence of small amounts of alcohol which is consumed. However, in case of chronic alcoholism, that is over a period of time, if the person consumes the alcohol continuously, it may however lead to muscle weakness and myopathy, that is muscle disease. The muscles will get diseased or damaged and they will become weak, so that their normal functioning or their normal performance will get hampered. Next is the effect on the kidney. The most prominent effect on the kidney is diuresis. Diuresis meaning there is increase in the urine output. Okay, so loss of water is increased. That particular process is known as diuresis. So now why this urine output is increased? There are two reasons for this. Because lot of water is consumed along with the alcohol. Okay, so the alcohol is diluted and it is consumed. Okay, so there is lot of consumption of water. Water intake is increased, and you are aware that if water, ingestion is increased or administration of water if it increases, obviously the body will try to adjust the amount of fluids. Okay, so excessive amount of water if it is ingested, your body will conserve as much as water which is required for the body, and the rest of the water is removed out of the body by means of urine through the kidneys. Okay, so because lot of water is ingested, urine output will be increased, that is diuresis will be seen. Another reason why diuresis is seen, because alcohol it results in inhibition of ADH secretion, that is anti-diuretic hormone secreted by the posterior pituitary gland. Now this hormone, it results in decrease in the urine output. Now since alcohol is inhibiting the secretion of ADH, opposite action will be shown, that is diuresis will be produced. Whereas if you consider the renal function, it is not affected. Okay, so renal impairment will not take place in case of excessive amount of alcohol being consumed. The next effect is on sex. Now this particular alcohol, it is reputed aphrodisiac, that is the sexual behavior is aggravated. Okay, so aggressive sexual behavior is seen under the influence of alcohol, because restraints are already lost. Okay, because it shows initial excitement, restraint is lost over here, or self-control is also lost, as we have seen under the effects on the CNS. Okay, however, chronic alcoholism, it may produce deleterious effect. It can result in impotence, testicular atrophy, that is the testes will get damaged so that the sperms are not produced appropriately. Gynecomastia may be seen, that is the enlargement of the breast in the males may be seen, and infertility may be produced both in males as well as in the females. That is, there will be a problem to conceive the child if there is excessive consumption of alcohol. Then next, coming to the effects on the endocrine system. Okay. Now this again, these effects will depend upon how much of alcohol is being consumed. Like suppose if the person is consuming moderate amount of alcohol, it will result in increase in the ADR release, that is adrenaline release, okay, from the neurons, that is adrenergic neuron. It is a neurotransmitter at the adrenergic system or sympathetic system. Okay, so release of the ADR will be increased, because of which hyperglycemia, that is increase in the blood glucose level, will be seen. However, in case of acute intoxication, that is, suppose if this person starts consuming more and more amount of alcohol, it can precipitate the intoxication. So, in this particular condition, however, it will result in hypoglycemia, that is decrease in the blood glucose level, and also the hepatic glycogen. Glycogen is a stored form of the glucose, okay, in the liver. Okay, so whatever amount of glucose is produced, if that much amount is not required, so excess amount which is produced, it is stored in the form of glycogen in the liver. So glycogen amount may also get depleted, okay, mainly because of the inhibition of gluconeogenesis, that is production of the glucose from other sources like amino acids is inhibited by the alcohol. Now, because it is producing hypoglycemia, glucose administration may be required, okay, at times in case of intoxication. You may have to give glucose to that particular person. Then one minor action is on the uterus, that is the uterine smooth muscle contractions. These are suppressed at the moderate levels, but this action is not very much significant. So this finishes the pharmacological actions of ethanol. Now coming to the pharmacokinetics. Now first part under this is absorption. Now the rate of absorption from the stomach region, it will depend upon how much alcohol is being consumed. That is, what is the amount of alcohol, what is the concentration of alcohol, whether the food is present or no, whether the food is consumed or no. But it is generally slow. Okay, that is absorption of the alcohol from the stomach region, it is generally slow to occur. Okay, and absorption from the intestine region, however, is faster to occur. Okay, so basically alcohol is getting absorbed from the intestines. Okay, so one more factor which will govern the absorption of ethanol is gastric emptying, that is movement of the content of the stomach into the small intestine. Okay, because the absorption of alcohol from the intestines is better or faster as compared to absorption of alcohol from the stomach region. So gastric emptying, that is the main factor in which is governing the rate of absorption of alcohol, because that will determine after how long the alcohol will reach the intestines. So faster the gastric emptying is, faster will be the rate of absorption of the alcohol. Then a small amount of first pass metabolism may also take place in the stomach and the liver. That is, the metabolism may take place before the alcohol is absorbed into the systemic circulation. So in the stomach itself, it may start getting metabolized, or through portal vein it may go to the liver, and over there it may start getting metabolized before it could enter the systemic circulation. Okay, but it is of limited value. It is not of great value. That is, much first pass metabolism may not take place. Okay. Then coming to the absorption from the absorption from the skin. The absorption from the skin of the adults, it is minimal. It is not very much significant. However, absorption from the skin of the infants, small or the newborn babies, it is quite significant. That is, the alcohol, if it is applied on the skin of the infants, it may significantly get absorbed into the systemic circulation of the baby, so that it can precipitate the adverse effects of the alcohol. So in case of fever, you are not supposed to use the alcohol sponges in the infants. Okay, because fever, why fever? Because once it is applied on the skin, we have seen under local action that it evaporates very quickly and it produces a cooling sensation. So it may help in reduction of the fever, okay, body temperature. However, in case of infants or small babies, you are not supposed to use alcohol sponges. Rather, you should prefer the ice water or cold water to reduce the fever rather than using the alcohol sponges, otherwise it will get absorbed systemically. And then if you see the distribution part, it is widely distributed throughout the body. It can also cross the blood-brain barrier very easily to produce CNS effects. It can also cross the placenta, so that it can also affect the fetus. So it is also having teratogenic effect, so it should be contraindicated during pregnancy. Then it is metabolized by oxidative process, that is oxidation is the main process of metabolism. 98% of the alcohol is metabolized by oxidation in the liver. And the pathway for metabolism of ethanol is as follows. Okay? So first reaction of metabolism of ethanol is conversion of ethanol to acetaldehyde. So ethanol is acted upon by the enzyme alcohol dehydrogenase and it converts the alcohol into acetaldehyde. Further, the next reaction is taking place in presence of aldehyde dehydrogenase. So aldehyde dehydrogenase, it acts on acetaldehyde and it converts it into the acetate. And further, this acetate quickly breaks down into carbon dioxide and water. Okay, so basically there are two enzymes which are involved. The first step, alcohol dehydrogenase, which converts ethanol to acetaldehyde, and the second enzyme, aldehyde dehydrogenase, which converts the acetaldehyde into acetate. Okay, so also hepatic microsomal enzymes, that is CYP2E1, is also involved in the metabolism of alcohol. Excretion of alcohol, it takes place mainly through kidney and the lungs. Okay, that is through exhaled air, but these are not quite very significant. So this is to do with the pharmacokinetics. Then coming to the drug interactions. Okay, so what exactly is happening when alcohol is consumed along with certain drugs? Okay, now first interaction is of alcohol with the other CNS depressant drugs. Okay, so other CNS depressant drugs like say for example anxiolytic drugs. Okay, anxiolytic drugs or say antidepressants, antihistaminics or hypnotics or the opioids. All of these have CNS depressant property. Okay, so because of this, since both are having CNS depressant property, motor impairment, additive motor impairment can take place. Okay, so because of this additive CNS depressant property, there are more chances of accidents to take place because both these alcohols as well as all these drugs, all of them have CNS depressant properties. So alcohol when consumed with these types of drugs, it may result in additive CNS depressant action, and motor impairment is more, so there are more chances of accidents. Okay, either traffic accidents or if the person is performing on say a machine, okay, or as a machine operator. So in that case also there are chances of accidents. So it should be advised not to consume alcohol in case if the person is supposed to drive or operate a machine. Okay. The next is if the alcohol is consumed along with drugs like sulfonylureas. Okay, these are anti-diabetic drugs, cefoperazone and metronidazole, which are antibiotics. So when they are combined with these drugs, it produces bizarre, somewhat disulfiram-like reactions. Bizarre meaning quite unusual type of reactions are produced. We will see what disulfiram-like reactions are under the aldehyde dehydrogenase inhibitor. Okay, the next interaction is with insulin and sulfonylureas. Again, these are anti-diabetic drugs which are used to control or reduce the blood glucose level in case of diabetes. So when alcohol is given along with these drugs, under the actions of alcohol in the endocrine system, we have seen that it produces the hypoglycemia. And these drugs also have hypoglycemic effect. So when both are given together, there will be enhanced hypoglycemia which is produced. Then the next interaction is in case of metabolism or the metabolizing enzymes. Now actions on the metabolizing enzymes or the CYP enzymes as they are known as, cytochrome P450 enzymes which are involved in metabolism of the drugs. Now here the effects on these enzymes depends upon the amount of alcohol which is consumed. Whether it is consumed in small amounts and for a short period of time, that is acute alcohol ingestion, that is consumption of alcohol over a short period of time, or whether the alcohol is being consumed over a period of time, that is chronic consumption. So acute alcohol ingestion, it will result in inhibition of the CYP enzymes, whereas chronic intake of alcohol, it will result in induction of the CYP enzyme. Okay, so acute or small amounts of alcohol for a short period of time, it will inhibit the metabolizing enzyme so that the metabolism of other drugs is inhibited, whereas chronic intake, that is over a period of time if the alcohol is consumed, it can induce the enzyme, that is it will enhance the activity of CYP enzymes and ultimately it will result in increase in the metabolism of certain drugs. There are few examples which are quoted over here. Formation of toxic metabolites of paracetamol, it is increased in case of chronic alcohols. Okay, because even glutathione depletion also takes place, so that the intermediate epoxide intermediates of paracetamol metabolism which is formed, that is also increased. Okay, because it is not further metabolized. Apart from that, tolbutamide, phenytoin, which is an anti-epileptic drug. Okay, so their metabolism also is getting affected. Another interaction is with the NSAIDs. Aspirin is one of the example of NSAIDs. So if alcohol is consumed when a person is already taking any one of the NSAIDs, there are more chances of gastric bleeding. Now gastric bleeding is a major complication with the use of NSAIDs. They result in increase in the gastric bleeding. Okay, so if alcohol is combined with these NSAIDs, there are more chances of gastric bleeding. Okay, when the two are combined. So these are the interactions. Coming to the contraindications. Now, what are the conditions in which the alcohol is not supposed to be consumed? Now actually alcohol is not a drug. It is not prescribed medically. No one will tell you consume alcohol for a particular disease or a particular condition. Okay, so though people may have an habit of consumption of alcohol, so what are the conditions in which you are supposed to control the consumption or prevent the consumption of alcohol? The first condition is the peptic ulcer or hyperacidity, or in case of if the person is suffering from GERD. Okay, so all these GIT related problems, the person should avoid alcohol, otherwise it will result in increase in the gastric secretion and will result in the relaxation of the LES. We have already considered these under the actions produced on the GIT. It can increase the gastric secretion and also it reduces the tone of the LES. So gastric secretion can be very dangerous in case of person who is suffering from peptic ulcer or hyperacidity person. GERD person, if the LES is relaxed, there is problem in these patients of regurgitation or reflux of gastric content into the esophagus. So alcohol will add to that by relaxing the lower esophageal sphincter. Next contraindication is in the epileptics, because the seizure threshold can be lowered. We have seen this under the actions of CNS. Okay, so seizures may be precipitated, so it should be avoided by the epileptic persons, otherwise the seizures epileptic attacks may get precipitated. Then the people who are suffering from severe liver disease. Okay, so already in case if the person's liver is altogether damaged, such persons should not consume alcohol, because it can have too much deleterious effects in the liver, because liver will not be able to metabolize the alcohol appropriately, and we have already seen the deleterious effects of alcohol on the liver. So it can be dangerous if already the person is suffering from liver damage, and if that person consumes alcohol, it can severely damage the liver. Next contraindication is the unstable personalities. Those who are mentally unstable or who are suffering from some kind of psychological conditions, okay, or psychosis. So they are not aware of deleterious effects of alcohol. Even they do not know how much amount of alcohol to be consumed. So there are more chances that such people may become dependent on alcohol. They may derive the euphoria and they will start becoming dependent on the alcohol. Okay, so there is high chances of abuse liability in such people who are mentally ill. Then the next contraindication is in case of pregnancy. Okay, so as we have seen under kinetics that it can easily cross the placenta to reach the fetus. So it will produce fetal alcohol syndrome. Okay, so it will show certain changes in the intrauterine life as well as postnatal life also. That is within the uterus when the baby is growing, when the fetus is growing in the mother's womb. At that time also there will be growth retardation plus postnatal, that is after birth also there may be certain growth defects or growth retardation which may take place. The baby which is born, it may have low IQ, microcephaly, that is the brain size may be low. Under the actions of CNS we have also seen that the alcohol damages the neurons. Okay? So cranial neurons also may be damaged or they may not be developed, so that the brain of the baby is not of appropriate size. It may be of a smaller size. Then there may be craniofacial abnormalities and other abnormalities. Craniofacial meaning those related to the brain and the face region. So you can identify that there is something wrong or some retardation has taken place just by looking at the baby, because facial abnormalities also will be seen. Apart from that, one more important deleterious effects is on the immunity of the baby. Okay, so immunity is also impaired or reduced. So because of this, there are more chances of other infections. Okay, so the baby is more prone or the child is more prone to development of the other infections because the inherent immunity of the baby is low. Apart from this, heavy drinking has also increased the chances of miscarriages, stillbirths, that the baby the body may not be developed appropriately, or low birth weight babies may be born. Okay, so this is to do with the contraindications. And then next coming to the toxicity. The toxicities are again categorized based upon the amount of alcohol which is being consumed. Now the first point is side effects which are shown after moderate drinking. Okay, there are small amounts if they are consumed. It may show side effects like nausea, vomiting, flushing, okay, hangover on the next day specifically, and because of the drowsiness or motor impairment, traffic accidents may be increased. Okay, so these are the side effects of moderate drinking. In case of acute alcoholic intoxication, okay, so because of increased consumption, if toxicity has taken place, it will result in unawareness. Okay, so the person will be in the confused state, will not be aware of what is going on around. Unresponsiveness towards the surroundings or whatever is going on around or the stimuli. Then stupor, the person may be lying flat. Hypotension may be precipitated, or gastritis, that is inflammation of the stomach. Hypoglycemia, respiratory depression may take place. At times respiratory collapse may be precipitated. Even the person may go into coma and even die. Then coming to the effects or the side effects which are shown after chronic alcoholism, that is if the person is consuming alcohol over a period of time. Okay, there are too many deleterious effects which are precipitated. Okay, because chronic alcoholism, if the person starts consuming alcohol over a period of time, the person may start developing the tolerance. Okay, now tolerance meaning requirement of a higher amount of substance to produce a particular amount of action. Okay, so your body will start tolerating all the effects of alcohol, and higher amount of alcohol may be required to produce a particular level of actions. Okay. Now here, because of the tolerance, the person may start consuming more and more alcohol, so that the person may start becoming psychologically dependent upon the alcohol. Okay, because the person can derive euphoria, so person may want to consume the drug again and again. Then at times, if the person is consuming alcohol round the clock, that is 24 hours heavy drinking if it is seen, then the person may become physically dependent. That is, the normal functioning of the body will not be proper if the person stops consuming the alcohol. Okay. Then apart from that, heavy drinking, if it is associated with nutritional deficiencies, it may result in neglection of the food or malabsorption may take place. Okay. So apart from that, impaired mental and physical performances may be seen. Neurological afflictions, okay, that is inflammation of certain neurons may take place, so that polyneuritis, that is damage of the many of the neurons may take place. Pellagra may be precipitated. Tremors, seizures, then loss of brain mass may take place. Wernicke's encephalopathy may be precipitated. Korsakoff's psychosis and megaloblastic anemia also may get precipitated. Apart from that, if the nutrition is neglected, we have already seen that cirrhosis of liver may also take place. Apart from that, the serious complications like hypertension, congestive heart failure, cardiac myopathy, or even arrhythmias and stroke may be precipitated. Apart from that, pancreatitis, an inflammation of the pancreas may take place. Then there are deleterious effects on the reproductive system, like impotence may be seen, gynecomastia, infertility may be precipitated. The skeletal myopathy, that is disease of the skeletal muscles, may also be precipitated. Moreover, immunity may get depressed. So this is one more bigger problem. Okay, that is because of reduction in the immunity, there are high chances of infections being getting indulged into the person. Okay, so there are more chances, or the person becomes more susceptible towards the infections. The next point is the uses of alcohol. Now, as such, the use of alcohol is restricted to the external application. Seldom it is consumed internally, except for it being present as a solvent in case of some internal preparations. Okay, so it is hardly prescribed for, or it is meant for internal use, but it is mostly restricted towards the external application. So coming to the uses, the first one is as an antiseptic, because in the local actions we have seen that it can kill the microorganisms. Okay, so that it is having antiseptic properties. So you will find it in most of the antiseptics. The next is as a rubefacient and counter irritant. This also we have covered under the local actions. It produces irritation in the areas, so it is acting as a counter irritant to reduce the irritation in the other areas. Rubefacient, that is, it produces redness due to vasodilatation in the areas, so it will relieve the sprains and the joint pains. Next use is to prevent the bed sores. So if it is rubbed onto the skin, it can prevent the bed sores. Then alcoholic sponges are also used to reduce the body temperature in case of fever. Okay. However, rather than giving alcohol sponges, it is better to prefer cold water or ice water, especially in the small babies. Okay, because alcohol can get absorbed from the skin also. The next use is in case of intractable neuralgias. Okay, like for example trigeminal neuralgia, wherein there is a pain which is produced due to the damage of the nerve which is supplying to that particular area. Okay, so the actual pain is not present, but because the nerve is damaged, wherever that nerve is supplying, in that area pain will be felt. Okay, so that is the meaning of intractable neuralgias. Okay, and in case of severe cancer pain, cancer patients, they suffer from severe pain, and in case of terminal cancer patients, it is quite severe. Okay, so what can be done is, how alcohol can serve in these two purposes is that Again, we have seen under the local actions of alcohol that once you inject the alcohol around a particular nerve, it permanently damages that particular neuron. So that neuron will lose its function permanently. So what you can do is, in these two conditions, whichever nerve is producing that pain, identify that nerve and inject the alcohol around that nerve. So once that nerve is damaged, the pain will not be felt. The next use is to ward off the cold, because alcohol, once it is applied, it will result in vasodilatation in that particular area, so warmth is produced. So coldness is reduced. The next action is as appetite stimulant and as a carminative. Then next use is as in case of fainting or hysteria, as a reflex stimulant this can be used. Okay, so it will be helpful in bringing the person back to consciousness. However, this particular use is not very much dependable, because under the actions on the respiration we have seen that alcohol may also directly depress the respiration. So other analeptic drugs we are supposed to prefer for this particular use. Okay, the next use is in case of treatment of methanol poisoning. That is, if methanol poisoning, which is the next type of alcohol which we are going to consider. So in case if methanol poisoning takes place, you can administer ethanol to that particular person, so that the metabolism of methanol is saturated by ethanol. So instead ethanol will be metabolized, and the harmful metabolites which are generated after methanol metabolism, they will not be generated, and the symptoms can be controlled. Then the next use is as an astringent. Okay, so under the local actions, again we have seen that alcohol can precipitate the surface protein, so it has astringent property. So it can be used in antiperspirant and in aftershave lotions. So this finishes the uses of ethanol.